A few days later, she texted me saying, I got my 4th jab at my GP. So I was really happy that I was able to make some change.
The Candid Community podcast would like to acknowledge the Wurundjeri Woiwurrung people of the Kulin Nation as the traditional custodians of the lands and waterways in the area now known as Merri-bek. We pay respects to their elders past, present and emerging, as well as to all First Peoples communities who significantly contribute to the life of the area. It has always and will always be Aboriginal land. Through this podcast series, we will provide space to listen to our residents and hear their candid stories and history with Merri-bek. These stories are those of our residents' lived experiences. The views, thoughts and opinions expressed in these episodes are those of the individuals interviewed and do not represent the position of Merri-bek City Council. The Candid Community podcast is made possible thanks to funding from the Department of Families, Fairness and Housing under the Local Partnerships Program supporting multicultural communities throughout coronavirus. So let's get candid. Welcome to the first episode of the Candid Community podcast. Today we will be joined by one of Merri-bek's very own Community Liaison Officers, Sarah Hussein, and Project Lead Petr Svoboda. They are both doing some amazing work around supporting our diverse community with all things COVID and community wellbeing. Welcome, Sarah and Peter. Would you like to start with telling us a bit about yourself, Sarah, and what made you want to sign up to the Community Liaison Officer program, which is otherwise known as a CLO?
My name is Sarah. I come from Egypt in the Middle East. I arrived in Australia about 7 years ago. I have 2 daughters and we don't have a family here. I'm just here with my husband and my 2 daughters. I've always had a passion for languages. So before I came to Australia, I was an accredited translator for over maybe 10 years. And when I came here, I was not able to continue my work as a translator. So I wanted to make a career shift where I can still benefit my community in terms of languages and also where I can help them maybe understand the system and access services, because language is a huge barrier in my community. So being a community liaison officer with Merri-bek Council now has been giving me this chance, and I feel lucky that I've been given this opportunity. Because I get to work directly with my community.
And what do you enjoy most about being a community liaison officer?
I think I like this kind of work where I connect a local government with the community. Because coming from the Middle East, I know that a lot of people in my community don't have that connection with the government. So I guess this is what I love the most, connecting my community with the government, and also still have some work around languages and accents, dialects and things like this, which I'm really passionate about.
And what do you do when you go out to meet with the community?
So when we book in an appointment with a community meeting, we usually make sure that we convey some messages to them regarding, first of all, of course, to wear masks if they are in a crowded place. And we usually provide the masks as well. We always provide them with rat tests too, in case they need to take some home with them. We also make sure that they understand about testing. If they have symptoms if they think they have COVID, they should have their tests. And they should always talk to their GPs also. If they are seniors or if they are eligible, they should talk to their GPs about the medication, the antiviral. And we also encourage them always to get vaccinated if they need to, and to stay up to date with the vaccinations. These are the main messages we always try to talk to them about.
And how have community members been able to access the CLO program?
It's very easy, really. So our numbers are on Merri-bek Council website, Merri-bek Conversations. Our pamphlets also have, the information pamphlets have our phone numbers. So anyone who needs help, they can reach out by contacting us directly on our phone numbers and they can ask us anything. If they need help, if they need to book in an appointment for their vaccination, we can do that for them. If they need help with travel to that, to and from, we can also help them with that. And being a CLO also, we can help them on so many levels. Doesn't necessarily need to be around the vaccination and stuff. So we can give them information about the new medication, for example, and respiratory clinics as well. So it's very easy to reach us. Just give us a phone call and we will be able to help you.
We also have the CLO program lead, Peter, here today to talk about how the program came about and the purpose it serves to our community during the uncertainty of COVID-19. Welcome, Peter.
So I'm Peter. I'm the coordinator of the program. This program is funded by the state government, and it's funded because the state government realized that they need to have people on the ground that are a bit independent and actually doing things that are needed to be done, and they don't need to say exactly what the state government is pushing us to say. They can translate it in their local languages and say it in a way that people understand. But the reason why we started the Community Liaison program is because people are kind of tired of listening to messages about get your next jab or wear a mask. And the people who have disengaged, they needed much more personal approach. So the Community Liaison Officers are the ones that go out and talk to people and have a kind of intimate one-on-one conversations or small group conversations. But the main reason why I think we need to do it now, after everyone feels like COVID has gone and we're back to normal, is because there's still the last push that we need to do. And the WHO secretary recently said quite an interesting. He made a speech. In that speech, he said that we have been in a better position at the end of the pandemic, and we are not there yet. But we know that the end is in sight. So he can see that it may actually end soon. But he gave an example of a marathon runner, a person who runs a long distance. He says the marathon runner does not stop when the finish line comes into view. She runs harder with all the energy she has left. So must we. We can now see the finish line and we are in a winning position, but now is the worst time to stop running. Now is the time to run harder and make sure we cross the line and reap the rewards of our hard work.
That's a great message for everyone to remember.
That's why we are putting all energy into talking to the people who are the most, potentially the most affected, the older people, and trying to find the small pockets of community members who have been either left out by the mainstream media or are not able to access the mainstream media. We want to engage them in a one-on-one way.
Would you be able to tell us about a situation where you were able to assist a resident as a community liaison officer?
I have been working as a CLO for about 6 weeks now, or maybe 5 weeks. I have been engaged directly with the community, which is something I really enjoy. And I remember talking to a Moroccan lady, she's a senior, and I've been trying to convince her to get her 4th jab. And she was really upset, like, why is the council so keen on this? What's the benefit for the council if we get their 4th vaccination? And I found it was a good opportunity to talk to her about the difference in terms of Australia and the Middle East, because coming from the Middle East, I know that most governments don't really work for the people's benefits, but it's different here, and this is what I tried to convey to her, that your local government it cares for you, for your health, for your well-being, and for you as a community member, your vaccination also keeps you safe, it keeps your family safe, it keeps the whole community safe. And I think she was convinced, and I was so happy that I conveyed that message in her own language, in Arabic. And a few days later, she texted me saying, I got my 4th jab at my GP. So I was really happy that I was able to make some change.
That's a fantastic result. Congratulations. You're making an amazing contribution to our community in the ongoing protection from COVID-19.
Thank you so much.
Would you be able to share a few proactive steps our community can take in order to protect themselves against COVID during the festive season this year?
These are the key messages that the state government and the public health organizations summarize and give us to pass on to the community. So there are 6 steps. So first, wearing a mask where you can't socially distance is important, especially in sensitive settings like when you go to hospital or when you go to aged care facility or when you're in a crowded space. It's really important to wear a mask. Second, it is important to let the fresh air in, and that a lot of facilities have air purifiers now. The additional point is that you should stay home. You should not come to work or to visit others when you're not well. Sarah mentioned we give out the rapid antigen tests. And if you're unwell, you should go and get the tests at local community testing sites. It's also important that now we have medications that actually save lives, especially for older people. So if you're eligible, you should definitely have a plan to get medication, get prescription. And when you're unwell, you should actually put in action and order them. The pharmacy can actually bring them to your door. And finally, getting vaccinated is the best protection in the long term against COVID.
Thank you for coming in and sharing your candid stories today, and sharing the amazing work you are doing with our residents, helping them access the support that everyone deserves and needs. Thanks again for listening to the Candid Community podcast. If any of the topics discussed in today's episode has caused distress, please reach out to the number of support networks listed in each of our episode descriptions. Take care, stay safe against COVID, and until next time, keep it candid.